Hello everyone, so today we're going to see the anatomy of the knee joint. So this is an image of the knee joint wherein this bone is the femur, this is the tibia. So this blue part here is the articular cartilage and the green part is the capsule. This red part here is the synovium, and within the synovium is the synovial fluid. So when there is a knee joint, it contains articulating bones, articular cartilage. In synovial joints, there will be synovium and synovial fluid, and then a capsule. So coming to articular cartilage, so this is normally present at the end of the long bone and it acts as a shock absorber, and also this is required for the gliding movement of joints. So the main types of arthritis that we see are osteoarthritis and rheumatoid arthritis. So coming to osteo and rheumatoid arthritis, we are going to see what are the major joints that are involved and not involved, that is, that are spared. So in osteoarthritis, the involved joints will be distal interphalangeal joint, that is right here, the distal interphalangeal joints. That is the most common joint that is involved in osteoarthritis, the generalized type. Second is the proximal interphalangeal joints. The proximal interphalangeal joints is next involved, and carpo-metacarpal joint can also be involved. So which joint is spared is the metacarpophalangeal joints. So this is the metacarpophalangeal, carpals, metacarpals, phalangeal. So this is the metacarpophalangeal joints. These are typically spared in osteoarthritis. So is the wrist joint. Wrist joint is also commonly spared. So this is about the joints of the hand which are involved in osteoarthritis. Coming to rheumatoid arthritis, it is almost the opposite of osteoarthritis. So metacarpophalangeal, the metacarpophalangeal joints, which are typically spared in osteoarthritis, are the most common joints that are involved in rheumatoid arthritis. Apart from that, the wrist joint and the proximal interphalangeal joints, these are most commonly involved in rheumatoid arthritis. The joint that is spared is the distal interphalangeal joint, which is most commonly involved in osteoarthritis. Okay, so coming to osteoarthritis, it is the most common joint disorder, and this is a degenerative disease. This most commonly occurs in old age, and it is a degenerative condition. It is not an inflammatory condition, it is a degenerative condition. So what happens due to the degeneration of articular cartilage? The main thing that is involved is the articular cartilage, which is degenerated. So due to this, there will be pain. So without any movement or with movement, there will be pain in osteoarthritis. Second, there will be sclerosis, that is, there will be an increase in the density of the bone. So there will be an increase in density of bone because the joint is weight bearing and the articular cartilage is also destroyed. So the bone needs to increase its density so as to bear the pressure. So that is the reason for sclerosis. Next is when the density of the bone is going to increase, there is not enough vascular supply. So that leads to bone death, which is necrosis. Finally, this leads to regeneration. So when there is regeneration, there is formation of abnormal bone such as osteophytes. This will lead to swelling and deformity of the joint, and that in turn will lead to decreased range of movement. So what are the causes of osteoarthritis? So there's primary cause and secondary cause. So the primary cause is idiopathic, the cause is not known, and that can be divided into localized and generalized. So, localized will be mostly individually affecting the knee joint, hand, or spine. So, generalized will be more than 3 joints will be involved, and most commonly the distal interphalangeal joint will be involved. Coming to secondary, intra-articular trauma. There will be a previous intra-articular trauma which will further lead to osteoarthritis. Second one is there might be avascular necrosis. So this also in the future might lead to osteoarthritis. Third is overweight. Overweight might also cause increased pressure leading to osteoarthritis. And the final one is developmental disorders. So there are 3 main developmental disorders which causes osteoarthritis. So first one we are going to see is the Perthes disease. So Perthes disease is when the blood supply to the femoral head of the hip joint is temporarily blocked. So when it gets blocked, the bone starts to necrose. So this will lead to weakened bone that will break apart, and so the round contour of the bone is lost. So this is the Perthes disease. Second one is DDH, which is developmental dysplasia of the hip joint. So this is when the ball and socket joint of the hip joint will not form properly. So this will lead to attaching of the femur directly to the pelvis. So this is also known as congenital dislocation of the hip joint. Third one that we're going to see is SCFE, which is slipped capital femoral epiphysis. So here what happens is, this commonly happens in the adolescence when the growth plate is damaged, and that will lead to the femoral head to move with respect to the rest of the femur. So what will happen, only the head of the femur will stay in the cup of the hip joint, whereas the rest of the femur will be displaced.